of our country. Okay. So INI-CET exams, as far as pediatrics point of view, from general pediatrics, you need to focus on anthropometry, developmental milestones, and the most important thing which is repeated many a times is severe acute malnutrition. From cardiology point of view, you need to be just thorough about two topics. One is the congenital heart diseases and the acute rheumatic fever. And a few questions from infective endocarditis, mainly the Duke's criteria. As far as respiratory medicine is concerned, from pediatrics, we need to know about the differences between croup versus epiglottitis, and we should also know about the congenital anomalies of larynx like laryngomalacia, and asthma. And not to forget pneumonia and cystic fibrosis. Remember, AIMS always focuses on emergency problems and emergency situations. So from pediatrics point of view, you need to know about the status epilepticus, status asthmaticus, and also very importantly about the procedures. Biomedical waste management, how to put a IV cannula, catheter sizes, cannula sizes, how to put an orogastric tube, and even steps of hand washing. All these are very important from INI-CET point of view. And again, from gastro point of view, you need to remember about the Wilson's disease and infantile hypertrophic pyloric stenosis. Coming to endocrinology, you need to know very importantly two topics. One is congenital hypothyroidism and congenital adrenal hyperplasia. Whereas rheumatology, always every year you get a bulk of questions from rheumatology. JDM is a very important topic, multiple times repeated. Juvenile idiopathic arthritis, and we also have the Kawasaki disease. And from the nephrology point of view, you need to be very thorough about the nephrotic syndrome, the nephritic syndrome, the differences and the case scenario. Alport syndrome is an important topic, as well as we need to know a very good idea about the UTI and the congenital anomalies of the kidney and the urinary tract. And last but not the least, we need to be aware about the fever with rashes and how you approach with fever with rashes and the congenital infections. Fever plus rash along with congenital infections. And lastly, from emergency and critical care point of view, you need to remember about some abnormalities in electrolyte, mostly hypokalemia or hyperkalemia, hypocalcemia, and pediatric shock management. There can be one or two questions from it. And regarding the most important part, apart from all this thing, is the neonatology. So from neonatology point of view, you should be thorough with neonatal seizures, neonatal jaundice, some algorithms related to neonatal polycythemia, infant